it shouldn't, it shouldn't be, on your porch after, after work is the wrong place at the wrong time. It's wrong that people can't be out in public spaces without worrying about their safety.
Now, speaking for myself, as someone who grew up in that environment, who grew up in violence, is once I got a gun, all that ceased because I didn't care.
Guns are extremely easy to obtain in this district. And I think also keeping in mind that we have rural and city caseloads, I think that a lot of people feel that there's just an inborn right to possess guns, regardless if you've been convicted of a felony or prohibited or not.
I think it's pretty safe to assume that kids that I'm working with in this neighborhood all know of someone that has a gun. I would even go a step further and say that if you speak with a kid at 6th grade or above, they know exactly where the gun is. And I would go so far as to say the kids that are in most of the kids that we work with in this community that are in high school can go to the gun if they feel they need it, if they want to show it. That's how prevalent it is.
In Chicago, we don't have a single gun store. And yet we have just an enormous problem with gun violence. And if we only ever arrest the end user with the gun and don't understand how the guns are getting into Chicago or how they're getting into the hands of young people or gang members, then I think we're missing an opportunity to really focus, I have a public health background, focus upstream on where the guns are coming from and really holding accountable the other players further up the chain that frankly are probably playing a bigger role in the gun violence problem that we see. So whether it's the dealers that look the other way when they're selling to prohibited purchasers or selling to straw buyers, buyers who are clearly buying for somebody else who couldn't themselves buy, or even, the traffickers who are going in and bringing in, making a buck, bringing guns into a community or selling them illegally to folks.
So many members of families have been injured in the past that there's almost an acceptance within the family that this is going to happen at some point. You make it or you don't. If you make it, these are your scars. I've had families that I've gone out to talk to from the trauma bay to explain the injuries we've identified and what needs to get done, and the response is to roll up a sleeve or a pant leg and show me their scars. So it's a very common accepted occurrence that I don't quite understand.